a yes or no answer. You've just described programs that you said would be devastating if emergency funding was not made available. Did the administration request funding in their 23 budget for the programs you just listed? Dr. Walensky?
I would have to get back with you in detail.
Dr. Califf?
I'm certain that parts of it were requested, but not the full amount.
Ms. O'Connell?
And we're beginning the process of figuring out how to absorb these costs into our annual budgets moving forward.
No, I asked, did they make a request? You came with very specific things that are going to be disastrous if emergency spending is not. Now, we're doing the 23 budget. The budget request has come in from the administration. Did they request these things?
It's been over a year since we've received COVID-specific funding. A lot has changed.
The administration just took money from the Strategic National Stockpile. They didn't ask for more. They took it. They asked for less. Dr. Fauci, are all the things that you just listed, are they in the 23 administration request of Congress to fund?
Some of them are, Senator, but not all of them, because at the time that we put in that request, the opportunities to do some of the things we've done were not absolutely apparent to us. So the direct answer to your question is not all of it is in the request.
Yeah. Are you beginning to see the pattern as to why a plan is important? Now, this has been a well-orchestrated event up to this point. It's done you damage. It really has. Dr. Califf, we hit the point in public health response where there's a commercial market for COVID vaccines, treatments, and diagnostics. Yet FDA is still limiting who can purchase vaccines and treatments under the EUA. Nothing in the law requires that the purchaser of an authorized or EUA vaccine or treatment must be government. Does FDA have a plan to allow states or healthcare providers, including payers, to purchase vaccines and treatments to help put purchasing decisions back in the hands of Americans rather than government?
Senator Burr, each of our major product areas, drugs, devices, biologics, is working with the industry to be transitioning. A number of them already have transitioned to full.
You understand what I read in the statement was you actually write into the EUA only government can purchase these.
That's correct.
And the law does not restrict anybody else from purchasing under an EUA. It's the limitation you put in the EUA, correct?
Yes, that's correct.
All right, let's talk about EUAs a little bit further. The EUA on antivirals. Did I misstate anything that the antiviral EUA states that it should only be prescribed to individuals that are at risk?
Right. Pfizer did a robust clinical trial that included people at risk, at higher risk by certain factors. We looked at the data. The data were compelling. That was the basis for the EUA.
And the EUA says to be prescribed to individuals at risk?
At those at high risk, yes.
So does test and treat violate the restrictions in the EUA if individuals who show up are not at risk, test positive, are given an antiviral?
My interpretation of test and treat is it's still prescribing Paxlovid is still within the EUA, and so only those who meet the risk criteria would be prescribed it.
So anybody that does not reach the risk criteria would be in violation of the EUA?
I think prescribing, as you know, is a complicated area of medical practice. So when you say in violation, I'm not sure what the legal meaning of that in the context of medical practice. But people who are low risk, like a 25-year-old with COVID and no comorbidities, would not be expected to get benefit, and so it wouldn't make sense to prescribe it.
Was the vice president at high risk when she took the antiviral?
I'm not aware of the vice president's clinical status, and as a physician, I wouldn't discuss a person's medical history.
Ms. O'Connell, just last week, HHS announced that it had found $10 billion in the couch out of those funds previously provided for COVID responses. I was surprised and frustrated to hear that these funds were overwhelmingly repurposed from within ASPR, including the stockpile. It's my understanding that over $1 billion will be taken from the Strategic National Stockpile. What are we giving up in the stockpile so that that $1 billion can be spread across the rest of response?
Thank you, Senator. Without additional funding, we've been forced to make very difficult decisions, make trade-offs that none of us want to make. And that included finding an additional $1 billion from the Strategic National Stockpile. That funding would have gone to securing the purchase of domestically manufactured surgical gowns in order to meet the requirement the Strategic National Stockpile has for surgical gowns. So we're going to be short there. We also are jeopardizing our ability to maintain the PPE at the levels that we currently are. Every piece of equipment we have is warehoused. The warehousing costs money.
Ms. O'Connell, you're the ASPR, and by statute, you're supposed to lead a pandemic. So I'm going to turn to you. Tell me what the plan is.
Well, the administration put forward a plan on March 3rd with how it would spend the additional funds that it was requesting.
I understand how you would spend it. Tell me what the plan is to get to some end game in COVID.
So our plan involves short-term providing, making sure all Americans have access to the critical tools needed to protect themselves. Medium-term, making sure that we have access to supplies moving forward, investing in domestic manufacturing so we're not caught short-footed like we were in March 2020. And then long-term, this research and development that we've talked about to get us to the next generation of vaccines that won't require multiple boosts, to get us to therapies that can be prescribed for everybody. That's where we need to go.
If you can take the outline you just presented to me and get somebody from the administration to fill in between the action steps that are going to be taken, you might have a plan. Thank you, Madam Chairman.
Senator Paul.
Dr. Fauci, the government recommends everybody take a booster over age 5. Are you aware of any studies that show reduction in hospitalization or death for children who take a booster?